Welcome, ladies and gentlemen, in my house in Meersen in the Netherlands. It's very inconvenient times, it's a strange time, and I'm very glad to be able to chair this symposium remotely. Obviously, and that is because of corona crisis, I am not able to meet you in person in Frankfurt, which is a pity, but we have found an alternative and I hope this will work out fine. What we will do today is present you about axial spondyloarthritis. We have a lot of novelty to share with you, and we have fantastic speakers that will do a lot of good work, I'm sure, in order to update you about all novelties with regard to axial spondyloarthritis. But before we do that, I have a few meeting disclosures to share with you. The first, obviously, is that the opinions and views expressed in this symposium are only those of the presenters and not of the sponsor of the symposium. We only talk about approved products, as always, and if you want to know about the products that we discussed, please look in the summary of product characteristics, better known to you as SPC. And then I should disclose to you that this virtual symposium is supported by Novartis. And then obviously, you shouldn't take photos, as always, and it is not necessary to record this symposium for the simple reason that this has been done by us. What are the learning objectives of this symposium? Well, it is obviously to educate all the attendees, like you, on the following aspects of axial spondyloarthritis. I'll start with introducing some challenges across the entire disease spectrum of axial spondyloarthritis. And then we move on with regard to monitoring disease progression, clinical aspects, imaging considerations. And after that, we go to a better understanding of each individual patient in order to improve long-term outcomes. What could be done? How could this be achieved? And then obviously to finish, we should talk about treatment options. Which are the options? What can we do for patients with axial spondyloarthritis? And you will definitely not be surprised that our focus is a little bit on IL-17 inhibition. So let me introduce you to our very, very distinguished faculty. I'll start off with some introductory remarks, and then the podium is for Professor Dennis Podabny from Germany. He's working in the Charité University Hospital, and he will be followed by Helena Marzo Ortega from the United Kingdom. And Helena will be very glad that she doesn't have to travel from Leeds Bradford to the mainland of Europe. And afterwards, we will finalize with Professor Atul Deodar from Portland, Oregon, in the United States. Here is the agenda. I'm currently doing the welcome and introduction. I'll later on do axial spondyloarthritis disease spectrum and tell you a little bit about the current priorities as well as the challenges. And then I will give the podium to Dennis, and he will talk about imaging in relation to clinical disease of axial spondyloarthritis, the novelties, the considerations. And then Helena will move to individualizing patient care, because all the information that we usually obtain is from group comparisons and group results. But in the end, we have to translate those group results into individual patients. And Helena will tell you how to do that. Finally, Dr. Deodar will speak about the management of axial spondyloarthritis in a somewhat broader context.